Good morning, Maven Reeves. I am Mihiraa. Let's start the warm-up sessions. What are the different roles of a nurse?
A nurse plays different roles in her profession. The primary role of a nurse is a caregiver. Apart from this role, she functions as a mediator, advocate, counselor, educator, and the like. A nurse plays a very crucial role in the healthcare system, connecting various departments in the industry for the welfare of patients.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
Tell me a quality that you possess that suits your profession.
I think I have excellent communication skills which help me to interact with my patients professionally. Apart from this, it also helps me to maintain a good relationship with my colleagues. So I think this is the one quality which suits my profession.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
Your preparation time is over. You can now start the role play.
Mihiraa, I've finished cleaning and redressing your wound. The wound looks clean and the dressing is in place to protect it. You've been doing a great job managing it so far. Well, how have you been feeling since your discharge?
I've been managing okay, I guess. But the wound is still a bit painful, and I'm not sure if it's healing well.
I understand your concern, Mihiraa. From my assessment, the dressing was intact, and there were no immediate signs of infection, such as severe swelling or discharge, which is a good sign. However, I can see that the wound is not healing as quickly as we would like. So, I would like to know about your understanding of wound care.
I've been following the wound care instructions carefully, keeping it clean and dry, and getting plenty of rest. However, I'm a little concerned it might be infected, based on what you mentioned.
I appreciate your diligence in following the wound care instructions, Mihiraa. Based on my assessment, your wound is clean, which is a positive sign. Moreover, you are on an antibiotic course, which helps prevent infection. While there are no clear signs of infection right now, it's good to stay vigilant. Signs of infection include increased swelling, severe pain, heat around the wound, increased redness, and unusual discharge. If you notice any of these symptoms, please seek medical attention immediately. For now, continue with your excellent wound care routine, and we'll keep monitoring it closely. You're doing a wonderful job, and I'm here to support you through this healing process.
Thank you for your reassurance. Is there anything specific I can do, beyond what we've already discussed, to further promote my wound healing?
You're very welcome, Mihiraa. In addition to what we've already discussed, continue to keep the wound clean and dry. Apply a new dressing if it gets wet or dirty. Rest is also very important, so make sure you're giving your body plenty of time to heal. For further promoting healing, focusing on your diet can make a significant difference. Eating foods rich in protein, like lean meats, beans, and nuts, can help repair tissues. Vitamins, especially vitamin C and vitamin A, are also crucial, so include fruits and vegetables like oranges, berries, and leafy greens in your meals. Staying well hydrated by drinking plenty of water is equally important. Mihiraa, do you have any other concerns or questions about your wound care or anything else? I'm here to help you in any way I can.
I was wondering about the stitches. How to manage them?
That's a good question, Mihiraa. The stitches you have are dissolvable, so there's no need for removal. They will dissolve on their own as your wound heals. Just continue with your wound care routine, keeping the area clean and dry. If you notice any signs of infection, such as increased redness, swelling, severe pain, heat around the wound, or unusual discharge, please seek medical attention immediately. You're doing an excellent job with your care, and these steps will help ensure your wound heals properly.
Thank you, Nurse Reeves. I feel more at ease now.
You're welcome, Mihiraa. I'll schedule our next visit for 5 days from now to check on your progress and ensure the wound is healing well. Before we wrap up, Mihiraa, let me summarize what we have discussed so far. I've finished cleaning and redressing your wound, which looks clean and protected with an intact dressing. However, the wound is not healing as quickly as we would like. But you've been doing a great job managing it so far. Then you too mentioned that the wound is still painful and expressed concern about its healing. I assured you that there are no immediate signs of infection, like severe swelling or discharge, which is good. You've been diligent in following the wound care instructions, keeping it clean and dry, and resting well. We discussed the importance of continuing these practices and being vigilant for signs of infection, such as increased swelling, pain, heat, redness, or unusual discharge. To further promote healing, focus on a diet rich in protein, vitamins, and plenty of hydration. Mihiraa, then we discussed that your stitches are dissolvable, so there's no need for removal. Just keep the area clean and dry as normal. If you notice any signs of infection, seek medical attention immediately. Finally, I have scheduled the next visit for 5 days from now to check on your progress. If you have any concerns or questions, don't hesitate to reach out. Take care, Mihiraa.